Opioid use disorder, or OUD, is a chronic but treatable condition that affects millions of people worldwide. It's characterized by a loss of control over opioid use, compulsive behaviors, and continued use despite harmful consequences. OUD can develop from prescribed pain medications like oxycodone or morphine, as well as from heroin or synthetic opioids such as fentanyl. Over time, the brain adapts to these substances, leading to tolerance and withdrawal symptoms when use is reduced or stopped. This makes quitting extremely challenging, even for those who want to stop. The disorder not only impacts the individual's health but also affects families, workplaces, and entire communities. Recognizing OUD as a medical condition is the first step toward effective treatment and recovery. Health consequences of OUD are wide-ranging and severe. Individuals with OUD face a significantly increased risk of overdose and death, especially with the rise of potent synthetic opioids like fentanyl. Injection drug use can lead to infections such as HIV, hepatitis B and C, and bacterial complications like abscesses or endocarditis. Chronic opioid use also causes constipation, hormonal imbalances, low bone density, and mental health issues such as depression and anxiety. Risk of suicide is notably higher among those with OUD. Additionally, people with OUD often struggle with other substance use disorders, compounding the dangers. Families and communities are affected too, with increased rates of child custody loss, stigma, and emotional distress. Understanding these risks highlights the urgent need for prevention, early diagnosis, and comprehensive care. Diagnosing OUD involves a careful assessment using criteria from the DSM-5, which looks for patterns such as loss of control, cravings, withdrawal, and continued use despite harm. Physicians also evaluate for related health issues and risk behaviors. Treatment is most effective when it includes medication, with and methadone as first-line options. These medications help reduce cravings and withdrawal symptoms, lowering the risk of overdose and supporting long-term recovery. Naltrexone is another option for highly motivated patients. Alongside medication, behavioral therapies, counseling, and peer recovery support play important roles. Harm reduction strategies like providing naloxone for overdose reversal, syringe service programs, and HIV prevention are crucial for those not ready to stop using opioids. Primary care providers are central to screening, initiating treatment, and connecting patients with resources, while addressing stigma and disparities in care. Improving outcomes for people with OUD requires coordinated efforts across healthcare systems. Professional guidelines recommend routine screening for unhealthy drug use in primary care, especially when effective treatment options are available. Physicians should ensure safe opioid prescribing, offer naloxone for overdose prevention, and address tobacco use, which can worsen outcomes. Immunizations against hepatitis and tetanus, as well as referrals to harm reduction services, are important preventive steps. Training for healthcare providers and families on recognizing and responding to overdose can save lives. Addressing disparities in access to treatment, especially for marginalized populations, is essential for equity. By integrating evidence-based practices, supporting patients and families, and reducing stigma, we can make meaningful progress in combating the opioid crisis and supporting recovery.